what would make sense, what makes us money. And I think hospital administrators, healthcare leaders, physicians certainly should be incredibly well paid from a value to society standpoint.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a special guest. Many of you, I'm sure, follow him or are aware of him out on the LinkedIn space. Alex, can you please kind of introduce yourself, your current role, and just a little bit about what you do?
That's kind. I'm operating with the assumption that nobody knows me, and so this will be the first introduction. I'm Alex Maiersperger. I lead global healthcare product marketing at SAS. As the day job, and then night job, side hustle, all other things as assigned. I'm the co-founder of the Advancement League, a membership organization for those advancing health, and home to the Young Health Leader Summit for early career, ambitious healthcare leaders and those who support them, mentor them, hire them. Headed into year 7 in May in Atlanta of 2025.
And you've done a lot of different things. I think this is what's great about your resume is, we love talking. One thing we've noticed is that even people who have very similar resumes, they have such drastically different stories. And then it's amplified when you have resumes that follow kind of a weird path. Then you find some really interesting insights. And that's why I really wanted to talk with you. You have your MHA and MPH, right? And you also have your bachelor's in public health, and you were an administrative fellow at one point. You've worked in both health insurance, and you've had a lot of experience with healthcare. I mean, you've done a lot of different things, and then you find yourself at this really unique organization. Just looking at the resume here, it's really impressive. But you've gained a lot of popularity from one of your posts here. It starts off with, I'm embarrassed, and it's gotten about 20 reposts and 1,600 likes on LinkedIn, which is a lot for LinkedIn. And you gain a lot of followers from this. And so it's talking about how, well, explain what the post is about, actually. I'll let you explain what the post is about, explain why it got so popular, and then also explain how kind of your story, if you don't mind, has invigorated people.
Yeah, I actually am. I didn't know you were going to bring up a specific post, so I could dig into this. But I think I remember the general purpose, and I probably post similar sentiments often. I think in the United States right now, we're betting on drugs and advanced technologies to really solve our health problems. We're effectively trying to out healthcare bad health. And so you see this all over the world as populations are getting older and sicker almost everywhere on earth. And in the United States, we just have that unique cultural mentality right now it's going to be wonder drug. It's going to be a healthcare intervention, a new surgical tool, a bigger, brighter hospital that has more advanced technology, that's going to be the thing that's really going to drive our health outcomes. And so we have this weird, just wording even around healthcare and health. They're just two very separate things. Even the way probably you see it in the way we structure our insurance benefits, where our brains and our teeth and our eyes are very separate from our overall health. And so even the way we sort of structure the payment model around our physical versus mental health, not to mention emotional, spiritual, dental care, all the things. So we just have the trouble distinguishing between health and healthcare quite a bit. And so my general purpose and some of the things that I share in a lot of the conversations that I'm having with healthcare leaders is we just need to be spending the same amount of time, both time, money, talent, so same amount of resources in addressing our health issues as our healthcare issues. And I think it's a unique aspect that healthcare leaders can step up in the country. Is a lot of times you see a healthcare leader and they're talking about Medicare policy and a specific payment model and a specific way we go about a reimbursement structure. All of that is well and good. I think equal airtime and equal amount of their time should be spent saying, here are the things that really drive health. Here are the things that our patients are struggling with before they come into the hospital. Here's some of the ways that we could fix that and do better. So some of it's simply a supply and demand issue. In so many regions, we just have endless demand. And so when you look at some hospital administrator resumes, some of the growth tactics that they've done or some of the things is just sort of right time, right place of this area has exploded in population. It's older and sicker and our hospital's thriving. And I don't know that we should celebrate that probably as much as we do currently.
Yeah, and I think it's a unique perspective, which is odd, right? Because after talking with you, I mean, one of the things that I brought to you was, isn't it a good thing that we spend so much on healthcare? Wouldn't there be something better? What's better to spend than on healthcare? And you had some really good points. I think what's interesting to me is a lot of people resonate with this messaging. Your posts get a lot of likes and a lot of engagement, and you're talked about as kind of a thought leader. Well, what's interesting though is it seems that we still don't really adopt a lot of the things that you say, or it's interesting, right? Because it's almost as if we like the posts, we listen to the podcast, we read the articles, we do a lot of these things, and then we kind of go about our our daily life, using our old models, right? And I'm not just talking about payment models. I'm talking really about philosophical models, right? I was, been trying to write an article on how value-based care is really more about philosophy than it really is about actual, changing the payment model around. And so why do you think it is that we struggle to actually make changes, even when you can go to a conference and, 1,000 or 2,000 people are in a room saying, this is a great, presentation, or this is a great thing that these people are saying, but then we never really follow up on it? Why is that, do you think?
Oh, it's so much easier to write something on the internet than it is to do something and make meaningful change. And so part of it is just the inertia of the current system and the current models that we have. And part of it is not to negate and just talk bad about the sort of current world that we live in or the current healthcare system. I'm just such a proponent of how amazing the American sick care and medical system is. If you have any rare disease or any sort of interesting just problem that can't be solved by some of traditional medicine, like America is the place you want to be. We have incredible specialists across almost every type of specialty. We have incredible researchers. We have incredible technology. And so I don't think that there's some people who are just very like anti our current healthcare system. We've got it's a lot of ways framed as health and healthcare, or a lot of ways currently it's framed as like healthcare versus health. I think you have to do both. We have to continue to invest in technology. We have to continue to invest in sick care type system. We have to have the best technology, the best researchers. We should be coming up with wonder drugs, all of those things. I don't think it's a conversation. It's an and conversation. And so part of it is just, I think the post you were talking about in question of like, I'm embarrassed. It is true. The basic sentiment was just, I've gone through a lot of education and a lot of parts of the healthcare ecosystem, and I can name specific parts of the Affordable Care Act, or I can talk to you about specific policies that insurers are implementing right now. I can talk to you about why hospitals are using certain technologies or not using certain other ones. But I can't name my senator from my current state of what they are focused on in the next round. Or I can't name 2 laws that I would change if I was given a magic wand today and it would fix our food system. Or I can't name like some of the very basic things, public parks, green space, safe space, some of the things that really we know as healthcare leaders drive better health outcomes and just keep people out of the current healthcare system that we have. The embarrassing fact is just like I have so much healthcare education and somehow I missed all the like health part of it. And so I think that just gets to the question of it's really hard to make those changes though. But I think some of it is we're not even having those conversations. And so maybe it's a quick soundbite on stage at a main conference, but nobody goes back and calls 5 of their healthcare friends and says, hey, I want to spend a Tuesday night. Can we talk about this? And then what is the actual sort of action we would take? Do we write our congressman? Do we write a policy brief and share it with 10 people and have them tweak it and have them make some changes? And then do we share that with a group? So some of it is just actually putting in the work. There's a little bit of inertia behind the like, hey, I love this message. It resonates with me. What we're trying to do at Advancement League and throughout the groups that we lead is bring that messaging and that excitement and that passion for certain topics and putting them into practice of how do you actually go take that back to your local community and how do you start making a difference. And we've seen people implement things and go and take it. And that's what sort of keeps us going into year 7.
Wow, so many good points. I think one of the big ones is it makes me think about the education system too, right? We complain so much about even our higher education system and how it's so expensive, but yet it really is one of the best in the world. I mean, if not the best in the world for higher education, it's one of the best institutions. And so it's the same thing with healthcare, right? I mean, we have the best trained physicians in the world here. And you can, if you speak to them, you'll realize like these people are extremely focused on their path, and they have tremendous resources available. And so sometimes they can feel like demonized or looked down on because, they're making, and charging a lot of money for some of these extreme conditions, but we don't necessarily want that to go away, right? Because they do deserve to get compensated. And some of these conditions are very hard to treat. It's really more so this other end of things, which is the health side, like you said. Can you explain real quick why they are different? When you talk about health versus kind of the healthcare, when you talk about kind of managing the population as a whole compared to those, serious conditions that we need, kind of extreme experts for and complicated treatments, what's the difference between those two concepts?
I've been really fortunate to host a podcast as well, so I'm excited to be on the other side of a microphone today and have a bunch of leading cancer experts on our podcast, the Health Pulse podcast. And one thing that has struck me is just how they speak about medicine versus lifestyle and how they speak about different countries and the way sort of you adopt health and healthcare strategies. And so it's probably echoing what a lot of people inherently know. But I think food is a big one. So food is probably the easiest and clearest example too. So if you have readily made processed food, and some of it's traced back to like the refrigerator and the ease of which, so the refrigerator pricing came down. So it came out and then it was expensive and then pricing came down. So people put a freezer out in their garage or wherever. And that led to just, you could have more shelf stable food. So essentially processed food that lasted forever in a fridge or freezer and all these things. So some of just the convenience you can trace back to historical decisions that were made and historical inventions and what that enabled, and goes back to like a car. You could have a bigger car to carry your bigger fridge and put in your house, and you could stock up on more food at a single time. So you didn't have to go to the grocery store because the grocery store was further. So some of it is cultural, some of it is historical inventions, all the things. The big challenges there are now, I think, just general common knowledge is probably like our food in the United States, or just the general diet that most of us adhere to, is fast, just in general. So like fast food or food that we get too fast, that comes from all over the world, maybe loses nutrients along the way or has supply chains that we don't really understand and all the things. And stays in our house for 30 days before we eat it, or 60 days or 90 days or 5 years, whatever containers we put them in. And so it's really easy to just start thinking through. And then we see the health problems that kind of rise since the 1980s. And so looking at those graphs and seeing the health challenges that we undergo now, it's pretty easy to start thinking through like, oh, well, maybe we eat different foods and maybe we're doing that in larger quantities and at larger times. So some of that convenience and access and just culture around eating obviously drives so much of our health concerns. And so once you can just pinpoint one easy example of like, oh, that's health that's really affecting healthcare. So on the population sense, at an individual level, if you're eating that food and then all your neighbors are eating that food, and then you see it play out in like hospital regions, it's pretty easy to make that jump. And then if you just start thinking through some of the rest of the things in your life of how far is the nearest park to you? Do you drive to it? Do you walk to it? Is it open at available hours? Does it feel safe? And you're like, shoot, now if I'm eating bad food and I'm also not getting exercise, or I'm not out in the sunlight, I'm not in a safe space, like think about that through. So I think just some of the thought process of what are the things that I'm doing in my life and how does that play out on a population level? And it's pretty easy to see like we're not getting healthier from some of our cultural and historical and just daily aspects of life. And so starting to think through those two also gets back to the funding mechanism. So if we do have a lot more healthy people, whether through wonder drug or through societal investment and invention, what does that do to the acute care hospital industry? And you already see, even with all the technological advances now, hospitals are moving into the outpatient setting or moving into community care or moving into home care. And so you already see it shifting without the population shifting towards healthier culture. And so just what does that mean as an industry and things, I think are all things we should be thinking about and actively working on.
This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more. So I like that you brought those issues up. Those are two really good ones. First, I guess we can look at food as the first one. Clearly that is not I've worked with a lot of neurologists when I was as a medical assistant, and, a lot of them have, MD, PhDs, or at least many years of experience focusing on a specific aspect of neurology. So like epileptologists, it clearly can't be their job to fix some of these problems because they're working, 80 hours a week, a lot of times into their, into their 60s, so, whose job is it, I guess, because that's a lot to take on for a lot of these doctors who are working in specialties. Even in primary care, I see a lot of doctors who are pretty overworked. Maybe they're not doing the research, but they still are seeing a huge patient volume. Whose responsibility is this to start implementing some of these required changes?
If you see the graph, and I don't know, I haven't done my fact checking on all of the graphs, but I think even if some are sensationalized a little bit, it's probably not far off. Where you see the last 20 years, the growth in physicians, and it's fairly flat. And then you see the growth in administrators and administration, and it's just like an explosion up and right. And so I do think number one, just physicians, I think you mentioned it a little bit earlier, of just physicians are heroes, and nurses and clinical staff we have such incredibly highly trained people that give up such an incredible portion of their lives and their talents and the other things that they could be doing in the community setting or the family setting to be there at 2 a.m. when we need them. So first off, I think we have to do something about the way we treat physicians and the way we treat nurses. Both in the inpatient type setting of physician lounges and like the way we like literally banish them to basements with no food, and we like make their lives very unhealthy by the work-life balance, both physician, nurses, clinical staff. And so I think one part of the administrative work that we have to do in the future and that we have to talk about more is just how do we create a better life balance for the people that are helping us literally live our lives. And so that's probably issue number one. We can shelf that and say, whose issue is it? I do think there is a little bit of collective responsibility. And so even if you're busy and you're a physician and you're saying like, hey, I'm so busy seeing these patients, they all come in because they have this food allergy. If that was the case, like that story would be told significantly enough of like, hey, we shouldn't have this food that people are immediately allergic to on our shelves. And there would be like collective action about it. The problem is so much of the food or so much of the culture that we have makes us sick very slowly. And somehow we're just insensitized to that. And so if you get sick over decades and that compounds and you have multiple chronic conditions, we are just generally more accepting of that. And so those stories don't get told in a way that was like, hey, this person came in, they're allergic to this. And the next person came in, they're allergic to this. Like, we got to do something about that right now. I think we'll get to the point, whether it's the payment model sort of forces us to, just from unsustainable payments. And we can't pay for healthcare as a country anymore because we're not able to pay for infrastructure and roads and airports. So at some point we'll be forced to. I hope we can collectively act before that. But I would say on the physician side, there is some responsibility to say, how can I tell this story in a compelling way? How do I explain what is hurting and damaging patients? And then that explosion on the administrator side, I do think we need to get some healthcare administrators more versed in the health world and more engaged in the policy and community building to be able to say, here's the things that are really going on. It's heartbreaking stories. They're true stories. Here's a way to tell them in a way that will spur action from the collective us.
So there is some work then that should fall on the physician, but also some work that needs to really get put onto the administrative side. One of the issues that I see though is that hospitals really are not originally set up, from what I understand, to care for public health in the way of we can't legislate food and things like that. And so where does the line get drawn, I guess, of what a hospital system can do? And then does that then fall on government? Is that the next person who's responsible?
Yeah, these are really tough questions. I appreciate being on the hot seat
Oh
here.
yeah.
I do have a few hospital administrator friends who are very much opposed to population health efforts or to sort of the public health efforts of like, I run an acute care hospital. Let me be incredible at the person who comes in the door. We're going to fix them the best we can. We're going to get them in and out as fast as possible. We're going to have the best technology, the best people, the best training. Like, let us do that. And all of the rest of it that happens outside of the hospital, have public health agencies and have government have all the things fix. I don't know where I fall actually on that spectrum, because I definitely do think if someone comes into the hospital and there are things that you can do outside of their lives, or if you have multiple chronic conditions and you can set up the structure in a way that treats a bunch of those better, like there's clearly many aspects of the inpatient hospital that still deal with quite a bit of the outside life that you have, or that can deal with them in a better way. So more coordinated, and even from a patient scheduling type efforts, we can improve there. I also don't feel that it's government's responsibility to solve sort of all of our problems. I think there's a lot of free market type solutions, and maybe some of that is regulation that needs to be lifted instead of more regulation, or we say, hey, the government has to step in here. Sometimes it might be government stepping out. And so I think there's not like one single solution that it's going to be, but I do think part of the solution is going to be having conversations like this and then moving it to a bigger, broader group, or moving it to an in-person group, moving it to a couple people who are influential in their distinctive fields. So a current hospital CEO that's moving up through the ranks, or someone, some of it's going to take a generation of leaders that are building off of the past, but building into maybe a little bit different of a future. So if all that we do, if you're a brand new hospital CEO, if all that you do is continue what's been built, we're going to continue to get the results that we've always gotten. And so if you just look at healthcare spending per outcomes and overall health and life expectancy, those trends aren't exactly the same. We're spending more money and we're getting less outcomes. And so it is going to take, I don't think we can pawn it all off onto the government side, or we can't ask hospitals to do everything. But it's going to take a whole generation of leaders to be able to say, here's the type of future that we want. Here are the type of goals that we're working towards. Here's what we're doing today, and here's what we're going to have to shift in the future. And it may take some uncomfortable administrative discussions or physician discussions. It's going to take a lot of uncomfortable discussions around, here's maybe parts of the economy that get a little bit bigger. Here's parts that get smaller. Maybe it's inpatient care does get smaller because the outpatient world or the population health world or public health world, those budgets will get bigger and some administrative shift will go to there. So it's going to take uncomfortable conversations, but I think it's going to take those conversations. And right now, I don't think we're having enough of them.
I agree. And I think on the administrative side too, sometimes, I mean, maybe this is a silly statement, but we've gotten to the point where physicians make for the hospital, I mean, usually at least 4 or 5 times more than what they're paying. Usually at least that. A lot of times it's more. So, you think primary care, I mean, they're easily bringing in usually well over $1 million, and they're getting paid around 220, 230. So I think at some point we're going to have that same conversation about administrators, right? Like, we're going to need an administrator to manage the administrators. So I think that's an interesting conversation as well, is we've had this huge growth in administrators to manage clinicians, and it seems like it's done well. It's squeezing out efficiency, but at the cost of burnout and at the cost of really low satisfaction, sometimes suicides. And so it's very serious, right? And now we're seeing diminishing returns where you can't really lower physician salaries. A lot of times physician salaries or clinician salaries in general aren't getting raised a lot. And then you also have some areas where nursing salaries have gotten incredibly high, but satisfaction still remains very low. if you're getting, assaulted at work by a patient, I'm assuming that no salary is going to really be able to make up for that. So these are really challenging questions. How can people get involved if they really want to get involved? Whether it's your organization or another organization, what's one of the first steps you recommend people take?
I actually wrote a post the other day about just not enough people have opinions on things, or not enough people are willing to share those opinions. So I do think it doesn't have to be social media. It can be one-on-one in a phone call. There's so many, it can be meeting someone at an event. It can be talking to a coworker at lunch. It can be all the things. But not enough people, so many of us are just so busy in our day-to-day lives that it's like, hey, I show up to work tomorrow. I'm going to do the thing that I did yesterday and do it a little faster, a little better. I'm going to show up the next day, do those same things without sort of stopping to say, I'm going to go to a lunch with a colleague and ask how they're approaching these problems. I'm going to call a friend on my way home from work and ask, just express a few opinions about what I think is going on and what would fix it. I don't know that we have. I think we might get to a little bit closer of a consensus, even on what you talked about, the payment model. So value-based care, there's some really strong thoughts about, does it work? Does it not work? Is there new words that it needs to include? Are there differences in the payment models? Could it be global capitation makes more sense than value-based care? I think some of the projecting 20 years out of, if you're a up and coming hospital administrator and you're saying, I need to think about what a hospital I would run looks like in 2040 or whatever time frame it is. Thinking about, like, how would we pay for it? What would make sense? What makes us money? And I think hospital administrators, healthcare leaders, physicians certainly should be incredibly well paid from a value to society standpoint. Sometimes healthcare gets picked on so much, and then you see all of the other ways that we spend money as a society. I mean, sometimes healthcare workers get unfairly victimized of, like, healthcare has all these problems. And I try to remind people that we still have a tobacco industry, and we still have a attention industry that you're getting paid for clicks and eyeballs, and excess money goes into some of the addictive type industries. When healthcare, you literally have a human being there at 2:30 a.m. ready to give you stitches or to open your heart and keep you breathing for a few more years so you can spend some time with your family. So there's some sort of unfair victimization as a category in the healthcare world. But I do think it really is important to be having these conversations, and that more people should be expressing their opinions of what, and just to have strong opinions in the first place. And so take a little bit of time at the end of a workday and say, hey, it makes no sense that I'm calling this insurance company and fighting over these fees. Let me look into that a little bit and let me think about what I would do to change it. And does it make sense? And then you share that with 2 or 3 people, and they say, oh, actually, it's the way this is because people tried to change that. And when they did this thing you're suggesting, it didn't work. And here's why. Maybe there's a different way. And you get to that third way and you start sharing it with people, and they say, okay, like, that actually makes quite a bit of sense. Like, 2 or 3 of us are going to be working at payers, or we actually have that job right now. Maybe that's something we suggest for our 2025, 2026 goals. So I think that's the way the world really changes. And then sometimes it's not reflected. There's so many people doing incredible things right now that are having those conversations, making those decisions, setting that strategy that never gets sort of press and publication. But I do think one day we'll wake up and the healthcare industry will be significantly different than it is now. And it's because of so much incredible work and inertia that's going on behind the scenes of people that are really willing to take the time and make the effort to say, here's what the future looks like and here's how we get there.
So you're hopeful overall.
I am a certified T-shirt wearing healthcare optimist. I do think so many of the challenges that we have are timing issues. And so if you look at a lot of things, I think the world generally, obviously there's incredibly heartbreaking stories and incredibly heartbreaking things that happen, but just as a very general sense, I think that up and to the right progress of the world generally gets healthier, wealthier, safer, and better, continues to march on. And I think the healthcare industry is very much like that. And so I think a lot of our current issues are current issues. You'll look back at a point in time and be like, man, what were we thinking? And it's just, that's kind of the point that it got to. And we lived through a little bit of that point in time reference. Mm-hmm. But there will be a time where You don't go to a hospital or an outpatient center and check in with a clipboard. There's going to be a time where it makes a lot of sense and they've got some information on you and it's easy to share and it's easily findable and you don't have to pay for it and all the things. And so a lot of that groundwork is being laid right now. And just sometimes it doesn't feel like it because you got to live through it.
And it takes a long time too. People are sometimes slow to come around. I know I am with new things, even new things that are good. I got a new computer recently, for example, and it still is, oh, I don't like the keyboard as much. I know this is a silly example, but people are that way in real life as well with things, right? Like the clipboard example. There's always going to be these little hitches, I think, that take people a little bit longer to adapt. And so I'm an optimist as well. I appreciate you saying that. That's awesome. So homework for the audience is to just call up somebody, message a friend, email a friend, talk about some of the problems, maybe get on social media, up to you. But that is homework for the audience, I think, is just, have an opinion, right? Get your voice out there, talk about some of the problems that you're facing and find some solutions. That's awesome. Really do appreciate you coming on, Alex. I really hope we can have you on again. 30 minutes is not enough time to talk about all the topics. So really appreciated you coming on.
Oh, appreciate the invite. Love your audience, and for everyone listening, just really rooting for you to find a career path and a community impact and a way to be impactful to the people around you in a way that just benefits your life and benefits those around you. I think there's so many good people. Healthcare truly, truly does have the best people. Like I said, repeatedly of just the 2:30 a.m. exists, I think, also for healthcare administrators. Of just, it is such a mission aligned industry that you're going to find people that really care about you individually and your success and your overall health. And that will continue on to your family and your community and those around you. So absolutely rooting for all the good things to happen throughout your careers and lives.